In this third section, we will discuss how to live our best life. While we focus quite a bit of attention on treating the disease, quality of life is important, and that means managing symptoms, side effects, and becoming an engaged patient so we feel good and do the things we enjoy. So I'm curious to hear from each of you. What would you say to a NET patient who wonders how to find a new normal in this roller coaster ride of living with NET? Dr. Hendifar, let's start with you.
Yeah, this is something that it's really hard for me to communicate with someone who's going through this, but all things that are involved with medicine, it takes a lot of time to heal. It takes a lot of time to adapt. So what I would just try to tell somebody is that, take time with it. It's not going to be something that happens very quickly.
Thank you, Dr. Hendifar. Dr. Lee, what about you?
I absolutely agree with that sentiment from Dr. Hendifar. I think this is a diagnosis that makes a significant impact on your life, and we have to be honest about that. We have to strive to make you feel as good as possible, even if that's not 100%, and that's okay. I think the goal is really to make sure that you are able to perform your day-to-day activities as much as possible so that you can live your life to its fullest during this time.
Thank you for that. Honesty leads to open conversations and then hopefully some solutions. Mary, let's hear from you.
Yeah, on the heels of what Dr. Lee said, I want to reassure you that you are not broken. I know it sounds kind of cliche, but the greatest lessons we have and the deepest appreciations usually come in our life from the hardest obstacles. And this diagnosis is a challenging obstacle. It's remarkable how many patients I've talked to over the very many years that I have been dealing with NETs that have shared with me how much more fulfilling and gratifying their life has become literally due to their diagnosis. Give yourself some time and some space to get here, but you will.
That's so beautiful, Mary. Thank you. Beth, let's hear from you.
Thank you, Mary, for emphasizing that aspect of this part of our path. It was that way for me, and I hope for many others. And the one thing that comes to mind for me is I'm not a big fan of the phrase new normal. By definition, normal means coming from something to be expected. New, by definition, is something not existing before. But as patients and caregivers, the terms new and normal can feel paradoxical. Many of us, if not all, receive our diagnosis long after the conception of our disease. Before that time, many aspects of our living seemed normal, yet were not. We knew the only thing the new for us is the validation or verification that we receive in our diagnosis, in the moment of now knowing. 6 years after my diagnosis, I am living and thriving in my now knowing.
That's beautiful, Beth. So we're excited to introduce our next set of speakers.
I am very excited and honored to be able to introduce Michel and hear and have him share his powerful story with us.
Coming up next is Dr. Sandy Kotaya from Mercy Medical Center. Her talk is titled Managing NET Symptoms and Treatment Side Effects.
I'm honored to introduce Dr. Julie Hallier, who is a surgical oncologist at Sunnybrook Health Sciences Cancer Center and has done amazing health outcomes research in neuroendocrine tumors. She'll be discussing with us achieving new outcomes for NETs. What do we know about how care is delivered?
And I would like to introduce Josh Mailman. He's a fellow NET patient since 2007. He's the president of NorCal CarciNet and the recipient of countless accolades and accomplishments, all with the sole purpose of improving treatments and advancing progress for a better quality of life and eventual cure for NET patients. He truly is one of the most dedicated and inspiring patient advocates we have in the NET community. His presentation is titled Being an Engaged Patient.
For our Spanish-speaking audience, NET patient Michel's presentations are also available to view in Spanish on our website. Thank you to our silver sponsors, Ipsen, Crinetics, and Tercera.